With leaders in Washington deadlocked over a deficit reduction plan, many elders are concerned. At stake are many programs that serve or support the elderly, from Medicare to veterans benefits. And decisions about the federal budget will also affect some adjustments for the cost of living. To give us an overview is our guest from AARP, Massachusetts. We'd like to welcome the new state director, Mike Festa. Thank you very much for being with us, Mike.
It's a pleasure to be here, Chris. I appreciate the opportunity to speak on these issues.
From the get-go, what you seem to be most concerned about right now is veterans. Why?
Well, I mean, first of all, a lot of our veterans are in that 50-plus category, and they are obviously directly affected by the change CPI issues, which are exactly the same concerns we have around the senior population.
Explain that change CPI.
Yeah, you know, when we get into Washington speak, it breaks down pretty quickly. It's a pretty straightforward concept, you know, to save money, and this is about saving money as some would see it, and there is an effect of that. They would look at the normal cost of living that's built into both the Social Security system and veterans benefits, and they would adjust that cost of living downward to accommodate what the social scientists say are the kinds of compromises that people make in their daily lives to spend less money on food and other consumer goods. And of course, the net result is going to be that Mary or John or whomever may be counting on this money to see not only immediately, but certainly in years ahead, a significant reduction in the check that they get every month that, frankly, for most of these folks, both seniors and our veterans, are their main source of income. I mean, it's a real challenge, and we're worried about it. AARP is certainly concerned about it. We've got a national campaign. We're focused on this question. We have been for frankly, for probably 6 months, because we've seen this issue percolate in different ways. And we want the public to know, your audience to know, that there's real implications, and sadly, implications that are very negative if we go forward and see these kinds of changes.
I guess there could also be a difference in whether we're talking about recently retired veterans or people who've been retired for a while.
Right. Yeah. Well, I mean, obviously, the longer you are in that veterans benefit system, the cost of living, you know, when you amortize it, or if you extend it out 20 years from now, if you compound that reduction, you're going to see that, you know, chipping away today at maybe $10 or $15 a month turn into exponentially a much greater number as time goes on. So the younger they are, the more implication of cost. And again, you know, for the budget cutters, they see this as a target to save money. We, frankly, feel that there are big issues of balancing this budget, deficit reduction questions that are out there that all of us should be talking about. But when you attack Social Security and veterans benefits as part of a, say, sequestration debate, or in simply to address a deficit problem of which neither one of these groups either caused or, frankly, should be bearing the burden of that, we've got real concerns. And AARP feels strongly that we need to advocate for these groups and protect them.
Now, one source of confusion is my understanding that Medicare benefits would not decrease, but there would be cuts in funding, and I guess that could be felt in some way.
Yeah, well, our view is that both with Medicare, which of course is that senior health insurance program, as well as Social Security, I mean, these are, you know, some people will call them entitlements as if that's a negative thing. But the truth of the matter is, we have all paid into that system. We have all paid into Social Security. We have all paid into Medicare. And the concern we have is that when you may say it's not going to cut Medicare direct benefit, but when you you extinguish monies or squeeze out monies into that system, and the direct implication is less benefit to the senior, then you're obviously, in our view, affecting their lives and affecting their quality of health care. But I will tell you this, our position is not that you can't save money in Medicare. It's the targeted savings ought to be against those who provide the services and, frankly, in some cases, wasteful duplication of costs. I think we all recognize that the healthcare system and the costs associated with healthcare are out of control. They have been for a long time. But the ultimate question is, how do you rein that in? Do you take the people who are dependent on that system and have them the ones that bear the cost, or do you look at the providers and those who are, frankly, benefiting from that system and asking them to look holistically at what their revenue sources are?
The drug manufacturers.
Well, you know something? For drug manufacturers, the cost of prescriptions, the cost of a lot of things, frankly, that people in Massachusetts think about every day. It's the uncovered costs of the co-payments. It's the it's the heating oil in New England, et cetera. There are actual costs that are non-discretionary, as we would see it as AARP, where people don't have real choices. You got to fill that oil tank. You've got to pay for that prescription. And we know, not just anecdotally, but this is a practice that when people run out of money, they are going to cut those pills in half. They're going to not buy those pills. And it's not a healthy situation, literally for that person and frankly for the society, that we would ask those folks who are least able to bear the burden to pay it.
How about having the drug manufacturers bear more of the burden? Because I guess they charge us more for these drugs in this country than they do in maybe many other
Well,
countries.
I don't want to get too far. Let's just say that that's a very rich subject of conversation. And I think, frankly, there's a history of that which, could result in at least 2 or 3 programs with you and I talking. I can say this. The savings that we need to have in Medicare going forward are something that AARP absolutely appreciates and will be at the table supporting what are appropriate cost savings. But we will not allow, at least in terms of without being strong advocates against this, we're not going to allow the first reaction to how to save money, being the ones who get these benefits are the ones to see the costs, that bear those costs. It goes back to the chain CPI point. The simple fact is it wouldn't be proposed if it wasn't intended to save money. The question is, how are they saving the money? Where are they taking the money from? In this case with chain CPI, they want veterans benefits less in 5 years and 10 years, and for senior citizens the same thing. We don't think that's acceptable, and we have worked very hard with our other allies, the veterans of all sorts. Washington's efforts around this, because it's a national issue. We've had a lot of support among those constituent groups that have an equal concern around these issues.
I think the people from Massachusetts in Congress pretty much see eye to eye with AARP, but if you look around the country, it's a different territory, and even among people who seem to be old enough to be members of AARP, a lot of them are supporting these Republicans in Congress. So
well, look, that may be frustrating, but our job is to inform people. I have to tell you something. I think all of us have done a bad job in connecting the dots. For a senior who may be socially conservative or have concerns about, bloated government or they want smaller government, they have a right to that opinion. AARP is nonpartisan. We don't delve into that. But I tell you what we have to do more of. We have to say to our members, and as the members have told us, that when you are concerned about an overall, sort of the government and whether it's too big or not big enough, you've got to always bring it back to who are the people affected by those choices. And as an organization that's, primary role is to support the voices of those who are 50 and plus, we see a real concern around the fact that some people in Washington think that solving the budget deficit problem short-term in sequestration or long-term in deficit reduction, you lead with the most vulnerable. And we just don't accept that. I have to tell you, by the way, and I say this with all due respect to every one of our congressional members, we want them to know that not only do we appreciate their strong historical support for a lot of the issues that AARP stands for, but we must, and we ask them to be ever vigilant about some of these issues, because they're going to reiterate in different ways. And we need them. We ask them as congressional allies to continue to support those constituencies that really have put them into office, but respect what they've done.
Thank you very much for being with us.
Thank you, Chris. Appreciate the opportunity.
Mike Festa from Mass AARP.